Welcome to the 2006 edition of the AMC Skit, The Return of the Rash Master, starring Michael Gibson as Dr. McLarin, and Colette Hall as Dr. Parker. Next, Elizabeth Hawke as Dr. Lovett. Next, Ketino Kobaidze as Dr. Ouderkirk. And Rodrick Lawton as Dr. Orija and Dr. Crosland. Next, Anupama Ravi as Nurse Rez. Next, Rashi Gambhir guest starring as Dr. A.K. Peel. Next, Taffere Mihretu as Dr. Yusuf. And finally, Francis McLeod as Dr. Pearlman. Jack Shern as our patient, medical student.
Guest starring Tanna Lim as Andrew Zadoff.
Hey, Dr. Parker, this is Nurse Rez. This patient is not doing too well. Please find out what is wrong with her.
Using my excellent physical exam skills, I will diagnose her and fix her. Look at that hepatojugular reflex. It is the best I've seen in years. Ah, yes, and notice the rapid wide descent of her neck veins. She's anemic. Let's get a soluble transferrin receptor and vitamin D levels. And a guest appearance from Dr. Bob Osburne, played by Daniel Frilingos.
Well, Brian, the Shanghai branch of the UKPDS trial clearly shows that in a patient like this, the cause is generally hypoglycemia.
What is this thing here? It looks like a Swan-Ganz catheter. That thing will never come in handy.
Hey, Andy, you know I saw a case like this at the Baylor University of Beijing. I think she has disseminated hepatitis C. Yes, let us review the physical findings in disseminated hepatitis C.
Yes, hi, Dr. Yusuf. This is Nurse Rez. Yes, there's this guy here you used to take care of, and her mother and father and cousins, and her brother, who is the CEO of Capital Hospital, and the whole hospital staff used to be your patients too. Yes, Dr. Yusuf, there's this guy, and I don't think that these doctors here know what they are doing. I'm sorry, I tried to call Dr. Ravi, but she wouldn't call back. Can you please help? Yes, thank you, Dr. Yusuf.
Dun, 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 dun. Dun, 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 dun. Dun, 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 dun. 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 Dun, dun, dun. What do you have? She's obviously unresponsive. But is she a DNR?
DNR, I think she's just hypoglycemic.
Yes, so is she DNR? She does not have a KUB, does she? Because you know she does not need one. Hypoglycemia? Is that all you could come up with? Oh man, you guys are terrible. I just gave a lecture on this 2 weeks ago. I guess you forgot already. You guys never read. You guys are weak. We used to work 130 hours when I was a resident.
Do you hear the summation gallop? Let me see the chart. Yes, elevated troponins. What do you think, Dr. A.K. Peel? But remember, A.K., there are at least 5 other things that cause elevated troponins other than MI. I think she needs cath now. We'll call Paul. Don't worry about the sodium. Remember, we're just consultants. Let's stick to our job.
Ring, ring. Hello? Peep of 5? No, let's put him on a peep of 6. I like even numbers. What? I have to do a bronc where? No, I have no time for that. It's Wednesday, you remember? Which means I had to cover Piedmont Shanghai and Piedmont Hong Kong today. Sorry about that. Where were we? Oh yes. I believe she is dying from hyperhamburgeremia.
He is dying.
Oh my, did you notice the pops and squeaks? Master always say, step back first to get the big picture. Ah yes, much clearer now.
Can't see through it.
I'm Bruce Lee. You may remember me from such movies as Enter the Dragon, where I whipped up on your American Idol Chuck Norris. After that movie, I came here to Atlanta Medical Center to get my wounds treated. They gave me excellent care, because I'm a movie star. But you are nobody. What about you? What if your doctor tells you you have lung cancer and you have 6 months to live? Who can you trust? Who can you turn to? Where do you go? You go here, to Atlanta Medical Center. Here. They will give you the excellent care that you deserve. Here, they can treat your lung cancer and cure you. You see, here at Atlanta Medical Center, there is hope. In this very conference room, every morning, there is a group of doctors discussing your case, the intimate details of your life, how many drugs you use, how many STDs you contracted in the past year. They are so smart, you tell them you drink a 2-pack every night, they know it's really a 12-pack. You will be treated by the finest of interns who just 1 week ago were carousing the beaches of Mexico City, and now they barely know where the bathroom is. But they will try their hardest and give you their best, and they pay attention to every little detail.
What's wrong with this test, with this X-ray?
Yeah, it kind of looks weird. Oh my God. Who's on call? Who's on call? Let's call the resident. Who's on call?
You see, you'll be treated by a group of doctors, and there is excellent communication between your primary care and your specialists.
Здравствуйте, вы по-русски разговариваете? Ничего не понимаете? О, жалко, жалко.
Your doctors here will be dedicated, determined, dependable.
No, she's out on maternity leave for the next 3 months.
Alright. So you see, if you want the best Atlanta has to offer, then go somewhere else. But if the ambulance just happens to bring you here, then come here in pride. This is Atlanta Medical Center, down the street from the drug houses and the BP.
How about a reflex hammer? Ah, what a great block. We'll try the ophthalmoscope.
Ah, that light is nothing to me with my special University of Michigan contacts on.
Ah, yes, but you forget the green light. Oh, I think I see rot spot.
No!
Now, you are mine. I will percuss you to your death. Pulmonary embolism. Dead again. She's dying. Sputum culture shows Canada. He needs caspofungin.
What? No more caspofungin! And this one, we don't need it. Finally, a good use for a swan.
I will get my secret weapons. Now, Avalox.
Oh, no. Avalox.
Ha! He wisely attempts to use my diabetic retinopathy and visual defects to his advantage. I will now attack him at his weak spot.
Now, my final move. Let me take out my pocket PC and consult. Oh, yes. The rip out heart and show opponent while it's beaten before it dies move. Wow. Well, that explains a lot.
So we meet again, Dermatology Master.
Yes, God of Journals. This reminds me of our showdowns in Germany and Ethiopia. And now for the final battle. Yes, another good reason why God created urine.
I will strike you with my journal saber. Take that!
Ha 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 ha! Your journals are weaker than the greatest distillation of sodium hydroxide. By the way, you should get that mole checked out.
Ha! No wonder it was to no effect. It's the Journal of the American Medical Association. Ha! I will use something stronger. Yes, I will go to my secret weapon, the Holy Grail of Journals, the New England Journal of Medicine.
Ha! Man who loves viruses. You may be an academician, but I have powers from on high. Hospitalist power.
Ah, boy, that was a good nap. Oh, what happened? Ah!
What is it?
Oh, man, I just had the weirdest dream. Oh. Yeah, I had this dream I was a doctor and I took a big pay cut to be a chief resident, and I just remember there were a lot of Indian women and pregnant people. Woo, man, talk about crazy.
It was just a dream. It was just a dream.
It's just a dream.
Go back to sleep.